Dr. Fishman. First off, what a lovely background. Where exactly are you today?
I'm in Fairmount Park on the Schuylkill River in Philadelphia.
Very jealous of you right now. Well, we have been talking a ton about, and you have really emphasized the importance that is empowering our patients in terms of educating them and really giving them some of the responsibility that is their treatment and more so their recovery in that process. It is really important for patients to understand that it's not all the responsibility of the pain management specialist, but there's things that we can do as patients to really better ourselves, better our recovery, and really feel that ownership over our overall lifestyle. So with that, I wanted to ask you a few questions today that revolves around empowering patients through education and pain management. So Dr. Fishman, first question, pain management is such a crucial field, yet many patients feel lost when it comes to understanding their options. Why do you feel or think that patient education is so important in this space?
I think the biggest challenge that I see on a regular basis in patients who come to me after having seen other physicians or having had other procedures or diagnoses assigned and performed on them is that they really have a very limited understanding of their condition, of the anatomy, and actually of what treatments they've had and the intent of those treatments. And pain care and interventional pain care is fairly complicated in some ways and fairly simple in others. But if you have a misinterpretation of the goals of, for example, a diagnostic injection, an injection that's supposed to only tell you, are you in the right spot, yes or no? And you think it's therapeutic, that it's going to give you pain relief for a long period of time, the perception of that individual is that that didn't work.
Mm-hmm.
It's really hard without an understanding of anatomy. And basic anatomy is easy to teach to people, especially who have specific problems in specific areas. I find it most impactful to do so with their own imaging. And so if you've never had anybody go through your MRI images with you, not just the report, and plan a procedure or an intervention for you, then I think you've had a disservice. And that disservice is that you've never really had the ability to see the condition that you're suffering from. And in many cases, it really is useful to use models and to use the actual images when you examine a person
Mm-hmm.
to help them and the clinician understand meaningfully what's causing the problem. I've seen way too many patients who come to me and tell me that they were never examined by their physician, which I think is crazy, or that they never looked at the images in front of them or just showed them the report. That is not how interventional pain care should be planned or executed. And to be fair, it's no wonder that many of those patients, when they come to me, have no idea what they had done because it was really never explained to them. So in my practice, everybody gets examined and everybody gets a review of their imaging because that is what we do. That is core to planning and executing on a treatment strategy, because you can't just decide what to do for a person based on a picture, and you can't just decide what to do for a person based on a report. You really need to evaluate them, listen to them, touch them, look at the appropriate studies, and then make a practical decision that brings relief and restores function.
Wow.
Yeah, we have to, we're not trying to weigh the stars,
Mm-hmm.
Carly. These people are our patients. They're right in front of us. They're not that far away. If you don't examine them, you're missing so much information.
You make it sound so much simpler. And I think it really is. It's just simple communication and not overloading them with like technical terms or analogies. Visual aids are key. I'm such a visual learner. So those models or the MRIs or the diagrams, those are all tools to help explain their condition, like nerve pain or spinal issues. So, I mean, you actually kind of just answered my second question. You touched on why it's so important to educate our patients, but you also went into some of your strategies. And I think visual aids is such a simple way to communicate those options for them. Do you have any other strategies to take it a bit further with patients, or do you mainly rely on those visual aids?
So one, visual aids are helpful. Two, I try to communicate with patients by email whenever possible so I can explain things in a back and forth manner. Three, you thankfully and I have been working on some online tools and other types of resources for patients. And mostly, I would say the best thing that I can get, if possible, is a patient who comes prepared, who takes notes, who brings a support person, who follows up and asks questions and shows me that they're really thinking about their condition too. Because at the end of the day, we have a serious problem that we're trying to solve. And it's not me solving it for them, it's us solving it together. And their
Mhm.
story matters. There's some pain conditions where even the smallest, tiniest little trivial historical um, piece of tidbit tells me a lot about what potential diagnosis I might consider for this person. And I know that a lot of people don't take the time to listen. I've been accused of that, but I also make sure to ask the right questions. And I think doing two things at once is really important in pain care: listening to the patient, and then also driving the conversation to, hey, where did this all start? Is there anything, any little minor accident, injury that came when these symptoms started? And in some cases, that tells almost the whole story. And in other cases, those particular details are not that important. But
Mhm.
at the end of the day, treating patients based on their hospital records and imaging is not what we do, but using as much information as possible to explain w- what is going on with them as simply as possible, right? Something called a unifying diagnosis. There's a philosophy that's called parsimony, where usually the simplest explanation is correct. And that's the way I approach pain care. And I need to approach it by looking at the picture, looking at the person, listening to the story, and evaluating those those images together. Um, I can't, just like this sculpture that I'm standing by, like I said, we can't just weigh the stars.
What
Um,
perfect timing.
and this is Corin der Herutian, the sculptor. So we'll give a little credit where credit is due. We're in this fantastic location. We're having a wonderful day. And at the end of the day, what I've learned about pain care is that with a good diagnosis and a solid treatment plan, many patients get dramatic improvement in their symptoms and function. What we also know is that if you give the wrong treatment to people or a treatment they don't need, all you're doing is accruing risk without benefit. And that's not good either. So let's all work on the side of patient empowerment to ensure that you really understand the three most important things about every treatment: the risks, the benefits, and the alternatives. The only other thing that we need to know is, what is the treatment for? Do I actually have that problem? What's my diagnosis? And if you know those things and your clinician's able to explain it to you in a way that's digestible and understandable, that you understand, I would feel pretty comfortable that that clinician is able to give you a solid chance of getting better.
Absolutely. That's a wonderful approach. You touched on so many angles that you really use in order to approach each patient and each condition. And it starts with really breaking it down to simple communication, um, really overcoming the complexities that a lot of patients are overwhelmed with. That is the medical field and the jargon, and just really getting on their level with a patient, asking them the right questions, gearing them towards the correct results. And that's an amazing approach. You also talked a lot about ongoing engagement and how that plays a key role for them to stick to their treatment plans, having people come with their questions, their own notes. And if you ever are in need, they can email you, text you, and get a hold of you. And I think the ongoing engagement piece is so critical, and it's very rare to find these days with doctors and specialists. So I loved that you hit that piece as well. You hit some amazing points, and I wanted to keep this pretty brief. So thank you so much for your time. Dr. Fishman, I'll ask you one final question. If there's one takeaway you want patients to remember about their role in pain management, what would it be?
You are the vessel, and we're here for you. So if you're not engaged in treatment, or if you have sinister beliefs that you're never going to get better, unfortunately, that's a real component of whether or not you do. So I know it's hard. I've been there myself. It's difficult to engage, but you're in this fight. And if you give up, it does become a lot more difficult to help you. And I would say that probably the best thing I can end with is say yes to yoga and say no to
Yes,
worries.
yes to yoga. No to worries. Thank you so much, Dr. Fishman, for educating us and empowering us. Thank you so much for having this conversation, and I'll talk to you soon.
Talk to you soon. Bye.
Bye.